Rachel Emmanuel brings the news each day. On Alberta Roundup, she has her say.
Hey everyone, welcome back to the Alberta Roundup. I'm your host, Rachel Emmanuel. Today, I am joined for the first time by Alberta's Mental Health and Addictions Minister, Dan Williams. Minister Williams, thank you so much for joining us today.
Thanks, Rachel.
Minister Williams and I have actually gotten to know each other a little bit at the Calgary Stampede, so it's great to see you here in maybe a more formal setting. So one of the things that we're going to be taking a look at today is our friends over in BC. We know that BC has a drastically different drug policy from Alberta. They have sought to decriminalize drugs. For the last 2 years, they had a pilot project that allowed adults to carry 2.5 grams of drugs for personal use without facing any criminal charges. And that was made possible through an exemption granted by Health Canada under the Controlled Drugs and Substances Act. Just recently, BC Premier David Eby asked for an adjustment to that exemption to recriminalize the use of those drugs in public spaces such as hospitals and restaurants. So one of the things that Alberta Premier Danielle Smith has been saying is, look, I understand that BC can control its own policies, but there's issues where we are worried that these drugs are going to be flowing into Alberta. And I know she's gotten the RCMP involved in that. So this change, it's just a minor change. Do you think that this is going to improve the situation here in Alberta?
Well, I don't think it's minor. Obviously, it's good for the country, and I think that's good for Alberta. A few things I want to highlight about how we got here. So BC decriminalized, which it's not just when they decriminalized, there's no criminal consequences to drug use, to public drug use that could endanger others. What they have are no consequences. No one apprehends the drugs and takes them. There's no administrative penalties. Most of this decriminalization that we see in places like BC and Oregon, both of whom have reversed their policy, come out of a misinformed understanding of what happened in Portugal in the early 2000s, where they decriminalized. But what they did in Portugal was heavily burden administratively somebody who uses drugs. So you go to a mandatory dissuasion commission if you're using even marijuana recreationally, never mind hard drugs like opioids. And if somebody's in addiction in their system in Portugal with the decriminalization, they can take away your social assistance, they can take away your social housing, they can take away your passport. These things are unconstitutional in Canada. I'm not suggesting we do that, but I'm saying they're trying to take a very complex situation that was built and made for another country in another decade with no fentanyl and a completely different legal system and a totally different culture, and take a child's understanding of it and impose it onto our societies here in North America, whether it be Oregon or BC. And it's been devastating, which is why BC went not even halfway through the 3-month trial pilot for decriminalization. I can tell you all the reasons why, and my experience as a Minister of Mental Health Addiction in Alberta, why decriminalization is a bad idea. But I think your viewers probably know it already. You don't need to be a Minister of Mental Health and Addiction, and you don't need a PhD in addiction medicine or social policy to understand that if there are no consequences for devastating, harmful, and life-ending drug use, that the drug use is going to expand and extrapolate. And so this is one of the big problems that we are facing in our society is a tragic addiction crisis. There is a response to it. There is a healthy human and compassionate response. It's not allowing addiction to just proliferate and facilitate everywhere it goes when it interfaces with government. It's governments and families and communities that need to intervene and say, no, there's a way to get healthy. There's a way to deal with this addiction. And we're calling that the Alberta model. It's focused on recovery. It's getting people off of the addiction to pathway, which leads addiction run its course, ends in only one of two ways, Rachel. It can only end in pain, misery, and eventually death, or it ends in treatment, recovery, and a second lease on life. Now, as a Minister of Mental Health and Addiction, I feel like I have a moral obligation to do all I can to get people into that second path, that one of hope, that one of recovery, the one that gets people healthy again when they're faced with that disease of addiction.
Sure. So when we take a look specifically at the BC policy here, and now they're kind of walking some of it back, I know that your government has actually asked the federal government to put chemical tracers in some of these drugs that BC was given out. That request was rejected. Government said that it wouldn't be possible. So I know we can't specifically track which drugs might be flowing into Alberta from BC, but if you had to just sort of speculate, I mean, what do you think the impact of BC's safe supply is on Alberta and the addictions that we're seeing here?
Great question, and it's really consequential. So we need to highlight the difference between two different devastating policies. One is the decriminalization. That one says no consequences for public drug use, for your drug use that endangers yourself, others, community. No consequences there in the criminal code. But then the second policy is one called safe supply or safer supply. They're euphemisms and they're branding, advertising slogans. It's not real policy in the sense of evidence-based, thoughtful, helpful for those struggling. What it is a program that says, and the federal government funds approximately $100 million of this a year, where they say, we are going to not only facilitate addiction, but we're going to do it to the point where we're going to provide high-powered opioids. So, for example, hydromorphone, the drug that the federal government supplies in their safe supply program, it's about 5 times more powerful than street heroin. So if you thought heroin was powerful, this stuff is pharmaceutical-grade opioid, and it's used recreationally, unwitnessed, without any intention of trying to taper people off of it. It's not like opioid agonist therapy, which is evidence-based medicine to help people get healthy and deal with the addiction that physiologically affects them. No, this is different. This is just flooding opioids onto the street. And there are approximately 65 million 8 milligram pills. Each of those pills, 5 times more powerful than heroin, that the government distributes unwitnessed into the community that is flooding our streets. Anecdotally, I can tell you in BC, the price went from a decade ago of hydromorphone, even less than that, 5-6 years ago. It was approximately $15 to $20 a pill. It's now in the neighborhood of 20, 30, 40 cents a pill. And Alberta, it's been decreased as well, not to the same degree. We saw it was maybe worth $15, $20 a pill previously, and now, anecdotally, I hear it can be worth somewhere in the neighborhood of $5 to $8 a pill. So what you can understand from that, if you know basics of supply and demand, that the federal government has now become effectively the provider of the drugs. They are, in some ways, trying to push out the drug dealers themselves as the purveyor of these high-power opioids. And it no longer becomes about harm reduction when you do that. It becomes harm production. It doesn't matter who gives those drugs out, whether it be a drug dealer or Justin Trudeau. The physical consequence of that to an individual's body is the same. And I'll tell you, the number one axiomatic rule of addiction policy is if you increase supply, you increase harms. It's just a correlation. There's no getting around it. The evidence on this in the literature is abundantly clear. So we put in a request, as you mentioned, to say, federal government, if you're going to continue doing this, which we oppose in Alberta, handing out these high-powered opioids on the street with no real policy to try and help people, but just to facilitate addiction, we've made it legal in Alberta, but we're concerned the stuff that you're producing in other provinces is crossing the border. And the anecdotal evidence suggests that that's true. We now hear multiple reports from RCMP saying they believe they have now seized tens of thousands of pills from the Safe Supply program, and that the RCMP publicly said they believe those pills were purposed for being sold in other provinces. Well, if you're in British Columbia and you have a whole bunch of high-powered opioids and it's going to be sold in another province, very tough for that province not to be Alberta, at least part of it. So we're very concerned about what we call diversion, which is these pills not going to the ones they're meant for, but instead going to our high schools and our colleges and hooking a whole bunch of people in a lifelong battle with addiction.
Yeah, a couple months back, I actually encouraged my audience to go watch those 2 really excellent documentaries. I'm sure you've seen them. I'm sure everyone in your office has seen them. Vancouver is Dying and Canada is Dying, both by filmmaker and friend of the show, Aaron Gunn. And I'd once again just reiterate that call. And in one of those films, we learned that it was actually creating youth as young as 12 years old to be addicted to these really high, powerful, high potent opioids. And I think if that wasn't the indication that it was time for BC to change its direction, I don't know what was. Obviously, now we see BC is slightly, changing its direction on the decriminalization. With that policy change in mind, are you guys still asking for the federal government to put that chemical tracer in? Or at this point, is it maybe a situation where you're really looking at BC and thinking they finally might understand the implications of what they've done?
Let me be clear. It's the federal government that enables all of these absolutely banana policies. The banana policy of handing drugs out to drug addicts to deal with an addiction crisis, you have to be a federal liberal to think that's going to help. It's insane. The policy around decriminalization, it's a federal exemption. I put this squarely in the federal government with their powers trying to infringe upon healthcare responsibilities in Alberta and other provinces, but also allowing BC to go down these roads. So I think it's a federal government that's responsible, and we are 100% still asking Minister Sachs and Minister Holland, the federal ministers responsible, to put a chemical identifier in the safe supply they produce. That technology of the unique chemical identifier is used for-profit pharmaceutical companies in the United States to protect their intellectual property of what they developed. If it's possible to be used for a decade in the United States for profit, then surely we can do it to save lives in Canada. I don't know what could be a better use of my federal tax dollars. I don't think a lot of them are going to good right now. I see the debt piling up and useless spending on item after item. How about something concrete? How about something that's going to save a life and give the federal government the data that they need to show that this is being diverted? We'd be able to see in autopsies if there are overdoses resulting from their safe supply. We'd be able to see in drug seizures the RCMP have, whether this was definitively from safe supply. I think they're afraid. I think they're afraid of what consequences that would be, not just politically, but also legally. The liability that they would have, I think, would be incredible if it were hard evidence to show what their safe supply has done to our communities.
Let's change directions a little bit and look at what Alberta is actually doing. You briefly mentioned the recovery-oriented system of care that your office is working on. The UCP government has been working on this since they were elected. So have you felt that you've had the federal government supports in your efforts to really encourage addicts to get into treatment and to get into recovery, as opposed to giving them so-called safe supply?
Well, they haven't brought it into Alberta. I mean, Prime Minister Justin Trudeau did mention at some point in passing that he was having conversations with municipalities in Alberta surrounding that. I hope to goodness that's not true. But we have made that illegal here. The federal government I even spoke with their health committee today at one of my recovery centers that I operate in central Alberta for them to see the hopeful, optimistic alternative to facilitating addiction. I'm not saying just lock people up. This isn't a criminal justice response. I'm not just saying let them languish. This isn't apathy. This is a conservative movement full of compassion. And my view, deeply informed by my conservative values, is that we have a responsibility to our community to intervene, to help these people, to give anyone struggling with addiction every resource imaginable. So we've invested close to $500 million in capital to build 2 so far out of 11 total recovery communities. 5 of them are in direct partnership with Indigenous, 4 on reserve with First Nations. We know that a strong relationship with Indigenous who are deeply affected by this crisis is really important. So we are spending a huge amount of resources to tell Albertans and all of Canadians there's another way, and to build a system that has continuous care, all of it leading towards recovery. Because if you're not leading towards recovery and addiction, the only alternative is to lead towards death. And I think that's deeply un-Canadian, to just let that happen, to facilitate it, to give up hope on people and say, you're addicted, I'm going to let that happen, nothing I can really do about it, here's a syringe, here's some drugs, here's a place for you to do it that's safe, apparently. I think that the appropriate response, wherever we can, is to get people into opportunities where they can see hope and therefore end up in recovery and live full lives again as Canadians and Albertans, as mothers and sisters and brothers, as family members and community members.
Yeah, I actually had the opportunity to visit one of those facilities, the one that recently opened up in Red Deer. How often would you say those facilities are at full capacity? There's just always people in them to the brim.
Well, ever since we opened them up, it's a staged opening. So we don't put the 75 folks in the Red Deer facility on day one. They go through the cohort and they graduate in time. But we're running at a very high capacity in the high 90s. If there's a bed open, it's really because it's earmarked for someone who's coming out of detox, and we're just making sure they have that space open. We have 2 out of 11 open. When we have all 11 open, we'll have increased our capacity by 2,000 spaces per year. And that 2,000 spaces is incredible because we're talking about the highest quality treatment, up to 1 year of treatment with social psycho supports, medical supports in that, and work with a continuum of care where we're doing a warm handoff to where they're going to afterwards as well. So the system we're building is universal in how it's trying to grab individuals and bring them into care so that we can get them out the other side recovered and full of life and opportunity again.
I know your government is doing a lot of work on, a recovery-oriented system of care, but overdoses in the province remain extremely high. They seem to just be going up and up and up. One of the things I'm curious about is during the COVID-19 pandemic, we saw so much isolation. People were told, stay in, don't go out. We're going to close your churches. We're going to close your schools. We're going to close your place of work. And we're going to coerce you into being vaccinated. And we saw mental health issues exponentially rise faster than we've probably ever seen them rise in Canada. And I think a lot of people were turning to substances to sort of alleviate some of the pain that they felt. How much of the overdoses that we're seeing now, how much of the addiction crisis that we're seeing now would you attribute to COVID-19 policy?
Well, it's very hard for me to give any concrete numbers. It's tough to tease these things apart. I'm sure there'll be lots of studying and data that will help inform academics to that end. But I can tell you that isolation it feeds addiction. Addiction, for example, in particular, when you're talking about mental health challenges, addiction really is a disease of isolation, of withdrawing into oneself and not being able to look oneself in the mirror, not being able to build relationships to others around in a meaningful and importantly healthy way. So often addiction is a consequence of other trauma, other mental health issues, a sense of loneliness and isolation. And so to rebuild that, we need to have these communities. And we saw numbers go up of addiction for multiple reasons. One, for the reasons you said, you put a lot of money in someone's hand who's struggling with addiction, and then you lock them away or say you effectively have to spend time independently by yourself. That's not a recipe for a healthy outcome. But then also we had to limit our capacity and intake when it came to our treatment facilities, which we were just starting to ramp up at the time. So it was something that was difficult for us as a government to try and manage both sides of that balancing act. But I can tell you now, we are seeing a lot of important facilities opening up that give us more capacity and a lot of opportunity for people to get the help they need. I'm looking forward on going full bore and both barrels all the way as hard as I can to get these facilities open and get the capacity going again.
Minister, just my last question here before I let you go. Your government announced a few months back the creation of Recovery Alberta. So mental health and addiction services are going to be moved from Alberta Health Services and to this new Recovery Alberta ministry that will fall under your department, of course. Wondering what the benefits are of moving this outside of AHS and whether it's still scheduled, these changes are still scheduled to go into effect beginning in July.
Yeah, we're hoping to be able to stand up on July 1st. We just passed one bill yesterday that's necessary for standing up part of this around CORE, the Canadian Centre of Recovery Excellence, and we introduced a new bill as well yesterday. So hopefully we'll have that figured out and hopefully the legislation passes. Now, the value of this is that we're focusing on mental health and addiction in a serious way. AHS is a big organization. It's literally the biggest employer in the country, 126,000 staff plus. That doesn't include casual. You see over $19 billion organization. Any one of the files that Minister LaGrange works on are massive and consequential. You talk about emergency wait times, EMS response, talk about surgeries, all of this adding up into what is a really important and complicated file. By taking mental health and addiction out, me as a minister, as a full minister now, by taking the part of AHS that dealt with mental health and addiction and giving it its own dedicated ministry and organization. Organizations now is going to be called Recovery Alberta, focusing on mental health and addiction recovery for health. It allows us to focus on it in a really serious way and to dig my shoulder into the grindstone and make sure that we're getting the policy outcomes we need. Canadians and Albertans are more aware of addiction and mental health in their families, communities than ever before. It deserves its own committed funds, its own budget line, its own organization. I can also change the culture. And AHS is an acute organization. Its culture is very different from addressing a challenge and a crisis like addiction or mental health. Mental health and addiction crises are often in the community. They're with family members. They're not in hospitals. If they've gotten to the point you're in an emergency hospital, we're way at the far end of this. We need to address this way before. And the culture of it can't just be acute, medicalized, pharmaceutical intervention exclusively. I'm talking about building community. And you'll notice Recovery Alberta, the language itself is about recovery and health. It's not just about responding in some medical way, but a healthy individual and the wellness that they need. Even look at our logos. You see the semicircle of chairs around the word recovery. It's talking about conversation and community coming together. We need to take a very serious look at how we think about mental health and addiction in the West. And if we over pharmaceuticalize and intervene exclusively in this highly acute medical way, we're going to be missing a lot of the important work that needs to happen before that's even started. And that's what Recovery Alberta allows us to do.
Minister, I know a lot of what you had to say and what your government's doing on addictions will really resonate with my viewers. Thank you so much for coming on today.
Thanks for inviting me, Rachel. I hope I can be invited back. I really appreciate the chance and the work you guys are doing.
Yes, absolutely. We'll definitely have you back. For the rest of you, I'll be back on Saturday with my regular programming, and just a little tease for you. I have a big story about the United Conservative Party and some action they're taking against COVID-19 vaccines, especially those for children. So you guys won't want to miss that. I'll see you all on Saturday. Have a great week, and God bless.